Melanoma, the most dangerous form of skin cancer. Melanoma is a cancerous growth that develops when unrepaired DNA damage to skin cells triggers mutations that lead the skin cells to multiply rapidly and form malignant tumours. Melanoma risk increases with exposure to UV radiation, particularly with episodes of sunburn, especially during childhood. This risk is increased for people who have increased numbers of unusual moles, depressed immune systems, and a family history of melanoma in a first-degree relative. So what does it look like? Well, to identify a melanoma, you can use the ABCD of melanoma. This looks at asymmetry, border, colour, diameter, and whether it is evolving. There are 4 different types of melanomas. 3 of them begin in the top layer of the skin and then sometimes become invasive, and the 4th is invasive from the start. The most common type of melanoma is a superficial spreading melanoma, and this accounts for 70% of all cases. Then there is the lentigo maligna, the acral lentiginous melanoma, and the nodular melanoma. Once the type of melanoma has been established, the next step is to classify the disease as to its degree of severity. Classifications for melanomas are called stages. The stage refers to the thickness, depth of penetration, and the degree to which the melanoma has spread. The staging is used to determine the treatment. The first step in the treatment is the removal of the melanoma, and the standard method of doing this is surgical excision. Surgery has made great advances in the past decade, and much less tissue is removed than was customary in the past. Patients do just as well after the lesser surgery, which is easier to tolerate and produces a smaller scar. The prevention measures are very simple and straightforward. They include: do not get sunburnt, avoid tanning, and never use UV tanning beds. Cover up with clothing, hats, and sunglasses. Use a broad spectrum sunscreen with SPF 15 or higher, and make sure you reapply this. Keep newborns out of the sun, and make sure you examine your skin head to toe every month. When examining your skin, follow 5 simple steps. So the first one, examine your body front and back in the mirror, then examine the right and the left side with your arms lifted in the air. Look carefully at your forearms and your upper arms and your hands, including the palms. 3, look at the back of your legs, your toes, and the soles of your feet. 4, examine the back of your neck and scalp with a hand mirror. And lastly, check your back and your bum with a hand mirror. Here at the Hornsby Cosmetic and Skin Cancer Clinic, we offer bulk billing skin cancer checkups. We are located at 1/32 Florence Street in Hornsby. We are open Thursday 8:30 a.m. to 4 p.m. So give us a call today on 94771661 or email us at contact@hornsbycosmetic.com.au to book your appointment.